So what benefits does Online Consult bring to you as a practice? So it supports the total triage model. I'm very aware that this is something that's being talked about a lot at the moment. You may have been getting guidance from NHSD or NHSE about this. An Online Consult fits perfectly into that. So it will support you to fulfill the requirements of delivering a total triage model. It facilitates remote working and business continuity. So more so right now because of COVID. This is really critical. It means that your clinicians and your admin staff can all support your patients from any location. So if people are working from home and they've got access to your clinical system or that mailbox where the forms are being submitted, then they can sit comfortably anywhere in the country, not necessarily in the practice, and they can basically process these incoming online consultation forms, which obviously supports your business continuity model. The solution should reduce the number of face-to-face GP appointments, which again is something we're all keen to try and achieve right now, and it allows you to focus on the patients with the most needs. So if we can free up those appointments, we can make sure that the people that need them the most are using them, and we're basically directing our other patients to self-serve and use the online tools. We think it should reduce your incoming calls as well to the practice. So you may, for example, at the current time, advise patients that they need to ring, let's say, for a sick note. If you can direct them through this online consult route to request a fit note, then you're potentially reducing the traffic on your telephone lines. So again, we're kind of shifting the workload around the practice, filtering it out and disseminating it accordingly, so it puts less pressure on those all-important resources. The solution will guide patients to the most appropriate service for their needs, and the forms that we have in there have clinical intelligence built into them. So as patients submit the forms and answer the multiple choice questions, they may be signposted to other services via a red flag or an amber flag. If they are presenting with something really serious, because the solution is meant to be for non-emergencies, then they will red flag and it will advise them to contact an alternative resource. We envisage that if an online consultation results in an actual consultation, whether that be telephone, video, or indeed face-to-face, that those consultations could potentially be shorter. So if you think currently in a standard 10-minute consultation, you might spend the first, say, 2, 3, 4 minutes chatting to the patient and asking them what the problem is, how long have they had it, what are the symptoms, have they tried any over-the-counter medication. You will already have that information in the form, so you're a step ahead. So if you've got that before you speak to them, you potentially already have a plan in mind or some guidance that you can give them, and therefore could potentially reduce that 10-minute appointment down somewhat. So it's going to introduce efficiencies in that sense. The package we offer you, you'll see on my slide here, we've got it termed as an out-of-the-box solution. So we're very conscious that everyone's really busy and we want you to get up and running with the solution as quickly as possible to benefit both yourself and your patients. So we do offer an out-of-the-box package. You can rest assured that all the content in that package is a trusted suite of resources, all designed and authored by clinicians at patient.info. So I'm hoping that a lot of you out there are familiar with the patient.info website. I believe that alongside NHS Choices are the two most trusted platforms for patients to visit for help and guidance on medical conditions. So Patient are part of EMIS Group, so we've joined forces with them, and Online Consult has been designed with their support and guidance. So you can be guaranteed that the content is a trusted source of information, and we're not directing people to websites and other resources that have not been verified or are not trusted. Whilst we give you the out-of-the-box solution, we do give you the tools in the product to tailor your own content to meet your requirements. The way that we've approached this so far with other practices is we've focused on getting them live with the out-of-the-box solution and embedding that and looking at the workflows and how it will integrate into your day-to-day working. And then at a later date, we can possibly look at considering how you might want to tailor your own content. And that can be local or regional. So it could just be signposting people to local services such as mental health or sexual health and that kind of thing. So there is a facility to create what we call your own topics on the platform where you can link and point patients to other resources. So what about patient benefits for them? So giving them access to guidance and self-help 365 days a year, 24/7. So when the practice is shut, out of hours, patients can sit on an evening, and if they've got something bothering them or troubling them, they can go on there, or if they've got an admin request, they can go on there and pop that through as well. It will help them because it will prevent unnecessary visits to the GP that are not needed or required, and it offers them an alternative method to seeking medical help if they don't want to book an appointment. Not everyone enjoys coming into the practice and seeing their GP, so it may be that it opens up opportunities for some of those patients who ordinarily wouldn't perhaps seek help, and they can do so, in confidence and knowing that the information that they're looking at is a trusted source, and they can get help in a different way. It improves access for patients with specific information and communication needs. So we may have patients with disabilities, things like hearing loss, or people who feel apprehensive about accessing health services, for example, those with mental health conditions. So there's lots of reasons, not, on an individual level for patients, why this will help them somewhat. People with learning difficulties and things like that as well. We've started to see real life use cases for these now, and it's interesting to get the feedback that we're receiving. We've noted here that potentially the system could detect significant conditions earlier. I mentioned about red flag options. So if a patient is filling in a form and it does flag up a significant condition or something and directs them elsewhere, potentially we could uncover conditions that ordinarily would have gone unnoticed, or maybe the patient would have waited 2 or 3 weeks for an appointment, and we can head it off sooner. So we do state that it could potentially do that and flag things up a little bit earlier in the process. It addresses both acute and long-term conditions, and of course prevents travel time for patients. And again, I think in the current climate with COVID, keeping people safe at home, both practice staff and patients, is key. And again, this solution supports that fully.